Our cancer genetics program allows patients to see cancer genetics experts that can help break down their hereditary risk for cancers.
Our cancer genetics program has two different pieces. On the risk assessment side of our practice, we're able to provide genetic counseling, potentially genetic testing for patients to understand what their lifetime cancer risks may be. Another part of our program is the Genetic Cancer Prevention Clinic, or GCPC. That is for patients where we've identified a known genetic mutation that we know causes cancer risk or cancer predisposition.
Genetic counselors really are care providers that look at your personal medical history, look at your family medical history, and determine if you may be at risk for a genetic condition.
Together, we evaluate their cancer risk and develop a plan to screen them for cancer.
The best scenario is that the genetic diagnosis is made in such that any cancer that may develop is caught in a very, very early stage such that the treatment is minimal.
When providers refer their patients to us, we keep them in the loop of what we've ordered for the patient, what the test results are, and what the follow-up recommendations are for their patients.
Our clinic can fill in the gaps, whatever is needed, and ensure that that referring provider is up to date with all the information that they need about that particular genetic mutation that their patient is dealing with. A provider that refers a patient to our program can feel really rest assured that their patient is in the hands of an expert and an expert team who does this every day. Within an NCI-accredited cancer center, we're able to offer them opportunities to potentially enroll in clinical trials, to get involved in research.
The wonderful thing about our genetic cancer prevention clinic is it does not replace the relationship that patients have with their existing physicians. We work in parallel with the teams of providers that they have already established care with.
There was a history of cancer in my family, so I decided to receive genetic testing, and I tested positive for Lee-Fraumeni syndrome. Basically, my body does not recognize cancer and stop it. Being faced with that, it was very difficult, it was daunting, and for a few years, I put off dealing with it. When I found this clinic, that was the first time I was able to take a deep breath and say, I'm okay.
What I love about this program is our multidisciplinary approach. We are the only one in the state of Texas who has all of these components under one roof.
We have a conference prior to seeing a patient in the clinic where we review all of the information. That way we really help streamline the visit and provide the most value for our patients when we see them.
Patients can come for one visit and see a genetic counselor, a provider, and a nurse navigator.
In our cancer genetics program in GCPC, we have a wealth of support services in addition to the clinic visit to offer to your patients. That includes things like social workers, support groups, specifically for patients also that have a high risk for cancer, which is a very unique niche need.
One of the most interesting aspects that we've been able to deliver is mental health support.
I do a lot of screenings, but the biggest decision that I made was receiving the prophylactic mastectomy. And I was comfortable in that decision because of my care team here.
To see Anaya thriving, we were able to intervene for her at a time before she had breast cancer. And to know that that is one little part of stress that we've removed from her life is pretty great.
I enjoy seeing patients who come in and tell me that they want to change the future for their children. We're able to come up with a screening plan, and we are going to change their future.
Family history does not have to be the future. That is of such critical importance to the ongoing health, not only of families, but of populations we serve.